I decided to go into pediatric DPC because I felt that it was part of the solution for all the problems affecting children and the health system today.
Medicine and pediatrics in general is all about connection, and when you feel like you aren't able to give enough to your patients in fee-for-service, you're running from room to room to room, you have to look for something else.
It was 2 years after I closed my fee-for-service practice. I was doing locum tenens and was realizing that I didn't really like having to follow the rules and regulations of another entity.
In a traditional model, I no longer felt like I could take care of patients in line with my values, and I couldn't take care of myself properly.
5 minutes with the patient's not enough. To me, a pediatrician needs to develop a relationship that's going to last a lifetime. And so I needed to spend the time with my patients, answer all of their parents' questions, and get a hug and play with them.
I think the biggest challenge is having families understand that there is another option and understand how it fits into the current system.
I would say my biggest challenge is pushing myself out of my comfort zone when it comes to things like networking and marketing.
So really having to step outside of the box, having to be uncomfortable and learn some new things, I think has been the hardest part.
I think now I'm going to be on 6 years in, so I think now my biggest challenge is hiring more pediatricians to join my practice.
Oh, my biggest joy is really like having the time that I want to have with patients and not feeling like I am rushing throughout my day. I would say that's followed closely by the joy of flexibility and autonomy.
I love the autonomy. I love that I can spend time with my patients.
My biggest joy is being able to do home visits. You can help in ways that you can't in the office.
I love doing those newborn visits where you're sitting on the floor at the patient's house with the dog or the baby and bonding with them in a way that you just can't do in a typical medical practice.
The amazing thing is that these kids not only view me as their pediatrician, but also like an uncle. It's everything I always wanted to be in a pediatrician.
One piece of advice I would say is doing the research beforehand in terms of seeking out some different models of direct primary care. Because, if you've seen one DPC, you've seen one DPC.
Health insurance is not health care, and just telling me you have health insurance doesn't mean you're actually getting good health care. Once people understand the model, come see the office and see how personalized it is and see what kind of care their children get, then they're committed.
Be prepared to be learning a lot because you can spread your wings, but you got to learn. You got to learn to fly while you're spreading your wings and having fun.
Anybody can do it. We can all learn new skills. So just have the confidence, know you can do it, know that there's support out there, that there are tons of resources out there. There's endless possibilities.
I would say be strong, believe in yourself. You're going to have some fears. You're going to overcome those fears because this model is the best way for you to practice medicine in a way that you thought you were going to practice medicine when you started medical school.
You survive medical school, you survive residency. You can do this. You've been through the worst. This is not that hard. You can do it.